Welcome to our video on cancer epidemiology and risk factors. Let's get started. Here's our overview slide, and we're going to start with epidemiology. When it comes to exams, examiners want students to know about the most common and the most lethal cancers in both males and females. In males, prostate cancer is the most common cancer, followed by lung and then colon cancer. In females, on the other hand, breast cancer is the most common cancer, followed by lung cancer and colon cancer. So very similar to males. In both males and females, lung cancer remains the leading cause of cancer-related deaths. So this is different than what's the most common, because remember, lung cancer is not the most common in males or females, but it's the most likely to kill them. After that, prostate cancer and then colon cancer in males, and then in females, breast cancer and then colon cancer. So now risk factors. There are many high-yield risk factors for cancer that are frequently tested on exams. So as you would expect, at the top of this list is cigarette smoking, and that can predispose people to many different types of cancer. And one of the most obvious types is lung cancer. In fact, smoking cessation is almost always the correct answer on board exams. And you should always think twice before dismissing that answer choice as incorrect. Just double check yourself because it's usually the correct answer. After all, in what situation would smoking cessation not be a good idea? Other notable risk factors for cancer include ultraviolet light or sun exposure, as well as exposure to certain pathogens and chemical substances. Now here's a table summarizing the most frequently tested pathogens in the context of their associated cancers. So going from top to bottom, both hepatitis B and hepatitis C viruses increase one's risk for developing hepatocellular carcinoma. And that one's pretty easy to remember because it's in the liver, hepatitis, hepatocellular carcinoma. Now next, Epstein-Barr virus has been linked to development of Hodgkin lymphoma, as well as nasopharyngeal carcinoma and Burkitt's lymphoma. And if you need help memorizing that, we actually have an EBV mnemonic in our microbiology section. And that's actually true for all of the pathogens we're discussing here. Now, human T lymphotrophic virus type 1, or thankfully you can abbreviate this as HTLV1, that's been linked to adult T-cell lymphoma. And right there, I think the title gives it all away. T lymphotropic, so T-cell lymphoma. Next, human papillomavirus, or HPV, is known to cause cervical cancer as well as different types of anogenital cancers. Human herpes virus 8, or HHV8, has been linked to Kaposi sarcoma. Lastly, Helicobacter pylori has been associated with malt lymphoma and gastric adenocarcinoma. Okay, so we just discussed pathogens and their associated cancers. This table summarizes the key chemical substances associated with various cancers. So first is asbestos, and that's associated with lung cancer and mesothelioma. Importantly, lung cancer is a more common sequela of long-term asbestos exposure than mesothelioma. So if ever presented with both of those cancers as separate answer choices, pick lung cancer over mesothelioma if the question stem doesn't present enough information to distinguish those two types of cancers clinically. So in other words, you don't know what the patient actually has, just default to thinking they most likely have lung cancer from asbestos. Now, arsenic has been linked to lung cancer as well as angiosarcoma of the liver and squamous cell carcinoma of the skin. Now, there's a bunch of metals like silica, chromium, and beryllium that have been associated with lung cancer. And hopefully you've noticed a pattern here that almost all of these things so far can cause lung cancer. And that's pretty intuitive because these ones, at least the ones that we've discussed so far in this table, can be inhaled. Okay, moving on to not lung cancer related chemicals. So exposure to vinyl chloride is associated with angiosarcoma of the liver, and exposure to aflatoxins also affects the liver by causing hepatocellular carcinoma. And then nitrosamines are associated with gastric adenocarcinoma. And lastly, alcohol has been linked to many different cancers, but the most notable one that you need to remember are oropharyngeal and esophageal cancer, and then the one you've probably heard of most frequently, hepatocellular carcinoma. And that one's pretty intuitive if you follow the logical progression of alcohol-induced cirrhosis, which can predispose them to developing hepatocellular carcinoma. Let's do a quick question. What is the number one avoidable risk factor for the majority of cancers? So as alluded to earlier, the number one avoidable risk factor for the vast majority of cancers is cigarette smoking. So once again, smoking cessation is almost always the correct answer. And that concludes this section.